Hello, Arushii. Welcome to Love Heals Cancer on ZenOnco.io. I'm Justina from ZenOnco.io. This is our cancer healing journey talk where we invite speakers who have gone through cancer, maybe as a patient, caregiver, or survivor. These CHs are very close to heart because many patients tell us that when they listen to others' journey, it inspires them. It boosts their confidence and gives them hope that if others can beat this disease successfully, why can't they? So, thank you so much for joining today's CHA talk. So, could you please introduce yourself and tell us how it all began?
Sure, sure. Thank you so much, Justina, and I would like to thank ZenOnco for giving me this opportunity. Uh, I and as you have already mentioned, I am Arushii, right? And yes, I was a cancer caregiver. My mother was a patient, uh, and she was a patient of non-Hodgkin's lymphoma. Okay, and I'll first of all want to call out that my story was not really a success story. So maybe I can just share what I have learned in hindsight, uh, and where all I think we went wrong, so that others can, no others sh- may decide to not do those mistakes. So that's what I'm here for. And yeah, so uh, it all began last year. In fact, I would say it is exactly 1 year. My mother started to have problems in the month of July last year, and around mid-July. Okay. And she started to complain about a lot of stomach issues, gastric problems, indigestion, pain in the stomach, right? Uh, and we thought probably it's just like maybe kuch, she ate something which did not suit her, or something was expired or anything like. So we just kept on ignoring and all. And one more reason was, at that time only, April, May, June, right, we had the second COVID wave, which was the bad one, right? So that was another big reason why we kept on saying to her to stay indoors and not to go to the doctor. And we also thought that probably we can wait for some more time, right? And yeah, so we kept on waiting, and her problem aggravated and all, right? And for I think a good, yeah, for I think a good 2 weeks.
Arushii, are you okay?
Yeah, so like I was saying, because at that time we had just escaped the second COVID wave. So we were also indoors, and my parents, we also kept forcing them to stay indoors, to not go to the doctor and all. So for I think 2 weeks, she kept saying that she has some problem in her stomach. She's not able to, she's not having proper stools, and she's having major constipation and everything. And later on, she started to complain about a major pain which she feels especially at night. And towards the end of those 2 weeks, she was not able to sleep at nights. Uh, that is when we thought probably, this could be something big, because not being able to sleep at night could be severe, right? And the bigger problem was, so we are three sisters, right? And all three of us are married, and we are all three in our own respective cities. My parents were there in my hometown, which is Agra, right? They had gone in that year only, in February, I think. Before that, they were living with my sister. and they got bored, so they said that they'll go back home. So that year, February, they went, and that's why they were alone. That time, and then I think in the first week of August, uh, I went home, and one of my sisters, my elder sister, she also came to my hometown. I mean, came home so that we could take her to the doctor and see what is happening and everything, right? And we took her to the doctor, and immediately an ultrasound was suggested. And in the ultrasound itself, the doctor had clearly told that there's some additional mass which is visible in her intestines. Okay. And he did give us an idea that this could be carcinogenic. And so my hometown is Agra. Okay. It's a tier 2 city near Delhi. Okay. And in Agra, like I said, none of us were there. And secondly, Agra is not one of those places which is very advanced in terms of medical facilities. To give some context, I don't think there is even one good oncologist in Agra. Okay, so we decided to take her to my sister's place. She lives in Lucknow, and again, uh, call it fate or what, for good 2 weeks she had a lot of inspections, blood tests, then she had endoscopy, she had colonoscopy, she had I don't know how many other tests. Okay, for some reason she kept her condition kept on worsening. Her heart started to get affected. She was not able to breathe. She was not able to go to the washroom on her own. Her condition kept on worsening, but no one was able to understand what is happening and why is it happening. Even an endoscopy and colonoscopy, nothing came out. Then ultimately, her heart gave up, and even while sitting, she was sweating as if she's bathing. Right, that much sweat was coming. So that's when we decided to get her hospitalized. And on 18th of August last year, she went for a PET CT. And in the PET CT, her entire, obviously, it was positive, and her entire digestive system was involved, right from her, I think, I don't know what this part is called, something, I don't know, some thorax, may some area is there, right from there till the large intestine end. Her entire digestive system was involved. It was such an advanced state. And the doctor over there had clearly told us that you don't even have 10 days. So, I mean, after hearing that, we were in a real soup because we didn't even know what cancer it is at that point in time, what cancer it is, what stage it is, right? And all those details. So the regular or the normal procedure that anybody would have followed would have been to go for a biopsy or something, so as to understand what cancer it is and accordingly decide what drug should be given, right? And because the doctor had told us that probably we don't even have 10 days, uh, and her condition was also showing that she, in the 2 weeks in which she was there in Lucknow, she had been taken to the hospital twice in emergency, right? uh, yeah. And when, as soon as we heard that, we said we'll go ahead with a basic chemotherapy so that at least she is able to, at least we can go back in time in terms of her stage. uh, so she was given the first chemotherapy on the same day within a time span of 3 hours, I think. uh, yeah, she was given CHOP at that time, right? That's a very basic chemotherapy. And within a day, her condition improved. Like today, she was not able to sit, she was not able to eat, she was not able to breathe properly. And next day, I think by evening, she was fine. She was eating, she was sitting, she was talking, she was laughing, everything. Once that happened, we thought probably we nailed it. Uh, and yeah, we thought, this is the right path, and we got the right doctor, everything. It does seem like a fairy tale. In ours, if you are able to diagnose, give the right treatment to a cancer patient, and within one day, if the patient is able to recover that much, right? And we thought probably we are the best, and we did it. We did everything right. And after that, every 21 days, she was given CHOP chemotherapy till 29th December 2021. Every 21 days. In between, however, we did have one or two complications. Once she had all of a sudden a lot of shivering, and when we tried to understand what that is and everything, so that could have been a sign of sepsis, which is like fatal in ours, which is like a infection in the blood. Okay, so could have been fatal, right? So that was one time when we didn't know what to do, and we just left it to God. And thankfully, it was not sepsis, and she was given meropenem, a very high dosage of antibiotics, and she came out of it, and she was fine. So we delayed that chemotherapy, and once again. Uh, After I think fourth chemotherapy, she started to say that she feels a lot of tingling in her right foot, right? And we again consulted, and we thought probably it's the side effect of chemotherapy. So one of the side effects of chemotherapy is neuropathy, right? So we thought it's one of the side effects of chemo. And she again and again she used to ask us to rub her feet so that she feels normal. We thought probably it's chemotherapy because her condition had improved drastically. Okay, she was eating on her own, she was doing everything on her own. Okay, and yeah, so 6 cycles were given, and 29th December was the last cycle, and we took her to the doctor on 30th December. No, 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 no. My bad. Last chemo was on 8th December. And on 29th December, after 21 days, we took her to the doctor to understand what is the stage, where are we, right? So the doctor suggested that we have two options. Either we can go for a PET again, or we can go for an ultrasound and understand whether the cancer has subsided or not. Okay. And we said that probably because she has already been through so much, and PET is a radioactive substance and this and that, we said probably we'll go for a ultrasound and understand. If we see there's any mass remaining, then probably we'll go for a PET. And magically, everything had cleared out from her intestines. We believed, and for I think 1 week or 10 days, um, she was fine. We shifted her to the room, and she was living the normal life. On 7th of January, she said that she's not able to move her right foot properly. Okay, again, we thought probably, some side effect, because chemotherapy side effects can be long term also, right? And up
Yeah.
Yeah. So I think in the starting first week of January 22 this year, she started complaining that she's not able to move her right foot uh, properly. And like I said, my mother was a diabetic. So we thought probably it's, and a long-term diabetic actually. So we thought it's diabetic neuropathy because in that also some, some tingling is felt and the control, loss of control little bit is there. So uh, we started her physiotherapy sessions, and in physiotherapy also there's this machine, stem machine karke. So she started getting sessions for that as well, and she used to really feel good, after the physiotherapy session. She was doing that, all the exercises very properly, and she was happy and jolly for a few days at least. uh, that continued for I think 5 6 weeks again. And I think on 22nd or 21st February, uh, she was just sitting down and she was making laddu. Right. Uh, all of a sudden, whatever she was holding, everything fell from her hand, and her right hand bones became stiff. She was not able to control her right hand, and she lost her speech. I mean, everything happened in a second. Uh, uh, yeah, that's when uh, things got really serious. Mm. Because until then it was all fine. So yeah, the very, I mean, at that time, whatever medicines could be given, we just gave those emergency medicines, and the very next day, she was taken for a MRI, and to understand what happened, whether she had a stroke or what happened. Uh, in the report, uh, basically it said that there is some uh, edema. Edema is kind of a swelling or some additional. It could be fluid. It's not really a mass, but could be fluid because of any injury or anything. So again, at that time, because the report said that it is edema, we gave her some medicines which could release the brain pressure, and I think in 2 3 days everything went to normal again. She started speaking, she started walking, talking, everything. But those incidents of um, losing voice became frequent. Every 1 or 2 days, she started losing her speech. That's uh, that's when we decided we have to go for a PET CT again, and we went for a PET CT, and we realized that uh, it uh, it was basically there in her right armpit, her groin area, and in the brain. Basically, the problem is PET CT, cannot reach the brain, right? But that radioactive medicine cannot reach the brain. So we were not 100% sure whether it had reached her brain or not, because PET CT cannot confirm that. And we had already gotten an MRI done. MRI did not say that there's cancer or there's a mass in her brain. So that's where we stood. So we 100% knew that cancer is back. And at that time, we had a very big decision because, you know, I mean, in Lucknow, we were not really getting any other option, or, we were not really understanding what to do next. So then my second sister, she lives in Bhopal. She knew an oncologist, a DM onco. We said we'll shift my mother to Bhopal. And I think within hours, we moved. Right. And the day when we reached Bhopal, the same day, my mother went through a CSF. Basically, there's a fluid in the spine. That fluid is extracted to check for malignancy. Uh, there was no malignancy in that fluid detected. So we went ahead and we said it could be something else, but intracranial chemotherapy cannot be given. And but because my mother's cancer had recurred or relapsed after 6 cycles of chemotherapy of CHOP, so she was given an aggressive treatment this time, which was ifosfamide, rituximab, ifosfamide, and a few more drugs. I don't remember their names. Yeah. Etoposide. Yeah. Rituximab, ifosfamide, and etoposide. These were the drugs which were given to her. And again, first chemotherapy, after the first chemotherapy, she improved. She had again started to walk and everything. I stayed with her after that chemotherapy for a good period of time. And she kept saying some vague things. For example, she used to say that she's able to feel the tingling in her entire body. And she used to say that for some reason she thinks she's losing control on her right side. She's not able to walk properly, or she's not able to control her right side that much. Because she had already had a foot drop in January, right? When she said that she's not able to control her right foot, it was diagnosed as a foot drop in the month of Feb. Okay. Yeah. Because she was not able to control her right foot, we thought probably, she's losing confidence. So we kept on pushing her, nahi mama, ki nothing like that. We kept on pushing her to not lose. Yeah, I mean, then she got her second chemotherapy. And after the second chemotherapy, when she came back, I think after 1 week or so, all of a sudden she fell in the bathroom. Her body froze, as in her limbs froze. Yeah, and she was rushed to the hospital. And she was in the ICU, and again, immediate hydration and everything treatment started. We started to find out what happened and everything. At time, ketones were identified, or ketones were diagnosed in her urine. So ketones are released in the body, when the sugar is at a very, very high level. And what happens is, then basically in the blood, if the sugar is at a high level, that means cells are not able to absorb the glucose, and which is why they don't have any energy. So the body releases glucose to convert fat into energy. So ketones were diagnosed, and for a good time period, ketones stayed, and she was kept on, very strong insulin, very strong hydration. And again, when she was in the ICU, she was not able to speak for a few days, uh, and she was kept on this medication. And after a few days, the ketones subsided, the swelling in her brain subsided, and she came out. And uh, again, she started to speak, talk to us, everything. But whenever we used to talk to her about something, she was giving vague answers. We did notice that, and we did tell the doctor. But sometimes what happened was, it felt as if she's not able to hear versus not able to understand, right? Uh, she had suffered some hearing loss because my mother was almost 70. Uh, so we thought probably she's not able to hear. And yeah, she came out of the ICU at that time. And the doctor said we were lucky because ketoacidosis, basically that was the ketones are called ketoacidosis. So the doctor said that ketoacidosis happens to, I think, 0.01% of the diabetics. And my mother was one of them. And yeah, so then came the time for her third chemo, or rather the ninth chemo, after one cycle on her second cycle of treatment. Then came the time for a third chemo, and she took the chemo, and she took rituximab, and the very next morning, she had a seizure, uh, and again, as soon as a seizure, she was taken to the ICU. Um, Again, we tried to identify what is the cause. Ketones, again the same cycle. The only difference was this time he was not recovering. 5 days passed, 7 days passed, 10 days passed in the ICU. She was not recovering. Then she was on symptomatic treatment in the ICU, and ultimately the doctor said that probably it's because now uh, there was nothing else the doctor could do. He had done 2 CSF both the times. No malignancy was diagnosed. So the doctor said probably he'll shift her to the room, and then we'll see how to go about it. And then she was shifted from the ICU to the hospital room, and still no improvement. She was not able to do anything, and she had started to show symptoms of paralysis. Basically, her, like she used to tell us in the month of March that she thinks she's not able to control her right side. Ultimately, she was not able to move her right side. So, yeah, that happened, and ultimately Ketones were again identified, and within this 1.5 month time frame, I think she lost 15 kgs. And and neurologists also visited her. A lot of medicines pertaining to the brain were also given to her. Nothing seemed to help. So then that's when the doctor said that, uh, you know, he's helpless and he cannot really do anything at that point in time. In case she recovers, then probably we can think of a chemo again. But as of now, nothing can be done. Uh, so we waited for 1 2 days and we tried to see if she would recover, but no, she didn't. So that's when we moved her, and eventually, in a time period of 15 days, I think she passed away. Uh, Within those 15 days, also, a lot had happened, but yeah, ultimately, her body gave up. So that was my journey, and I think few things which I've learned in this entire 1 year are, first of all, and very important, you cannot and you should not rely on one doctor. Whatever, however smart, however highly qualified, whatever, you cannot rely on one doctor's opinion. Please, please, please go for at least 2 or 3 opinions if the time permits you. If the time does not permit you, then I understand, probably you have to take some immediate actions. But if you have the luxury of time, please do consult at least 2 to 3 doctors. Uh, it might seem as an additional expense, but trust me, it is definitely worth it. Uh, that's one. Second thing is probably cancer is something, it can do anything to the body at any point in time. By the time you realize something has happened, it could be too late. So even if the patient is not showing any symptoms or any problems or anything, do get regular tests done. Could be PET CT, could be, depending upon what the case is. Please do get as many intermediary tests done as possible to ensure that you know the treatment is affecting the way you want it to. Don't wait for the end. That's my biggest second learning. And my third learning is probably, you know, the patient knows, the patient is the one who is suffering, right? If the patient is saying the smallest thing, listen to it. Because, like I said, cancer can do anything to the body, right? And it could be a starting of something, right? So, better to not ignore it, because even 1 day delay can cost you a lot. So, and these 3 mistakes we have done, all these 3 mistakes. So, yeah, I think if we had not done these 3 mistakes, probably the outcome could have been very different. Yeah, that's it from my end. If you want, we can have any specific discussions.
Okay, Arushii, thank you so much for sharing, because it was very hard for you also, because this happened very recently and it's hard to, say goodbye to the loved ones. whom you love so much, and you see them suffer, and then all of a sudden they just disappear from your life. So it's very hard. I understand. And thank you so much for coming up and sharing here in our platform. So I just wanted to ask few things that did your mother had any kind of family history from her side of cancer?
Yeah, yeah. So my grandmother, my mother's mother, she also passed away to cancer, to gallbladder cancer. But she was, I think, 83 or 84 when she was diagnosed. So at that time, the doctor had clearly told, you know, whether she will be able to take chemotherapy or not. So, yeah, so that was one. And one of my uncles, my mother's brother, he had also passed away to cancer, lung cancer. And he was diagnosed at a early stage, I think in his 40s, early 40s. So yeah, definitely there was a family history, but we did reach out to to understand whether this could be a genetic thing. Turns out all these three cancers are from three different families. I mean, I'm just saying what has been told to me. Three different families of cancer, so there's a high chance that these were not genetically related. These were all independent mutations. So yeah, uh, we did have a family history, but not really sure if they were really cause.
Okay. So, what, like, as you said, that there was no proper, like, family history because it's from different different families. So it was not much sorted. So, what?
No. I think you got it wrong. So what I meant was, um, so my same family only, my mother's mother and my mother's own brother, right? But three different families of cancer, as in, like my mother was a lymphoma patient, my uncle was a lung cancer patient, and my nani, my grandmother, was a gallbladder cancer patient. So these three cancers, from what I have been told, are three different families of cancer, right? So as far as I know, the cancer is also divided into different families. So as per the report, basically these were not related and these were independent mutations.
All right.
Yeah.
So, as this was kind of not like very shocking from,
Yeah. Hmm.
so what was your family's reaction and your relatives' reaction when this was diagnosed?
So, like I said, the diagnosis itself had taken a lot of time in my mother's case. In fact, that year only, 2021 only, in the month of February end, she had complained of excessive weakness, right? That she was not able to walk and all. I mean, weakness, nothing else. So then she said that probably because of COVID, she's not stepping out. So that is why she's feeling the weakness. She's not able to do her regular yoga exercises and everything. So she said probably that is the reason, and we moved on. So yeah, I mean, when it was diagnosed, probably my me and my sisters. So basically, both my elder sisters and my brother-in-laws, they are all four of them are doctors. So somewhere, we had an idea that this was something big. It was not a small, uh, indigestion or anything of that sorts, because my mother was one of the most active persons in the family, even in the second wave of COVID, which was April, May, June of the same year, right? She was doing all the household chores on her own, right? From cooking, utensils, washing, mopping, everything. and in the month of July, she was bedridden. So my mother was one of the most active members, and we had never thought in our wildest dreams that she will, you know, because she was so active and no history of smoking, no history of drinking, never. In fact, she never had onions or garlic also. She was, I mean, no offense against anyone, but that is what she used to believe that, because she was very religious and all, so she never had onions and garlic as well. I think once in 5 years she would have stepped out uh, to eat outside. Uh, so yeah, never in our wildest dreams we had thought that she would be diagnosed with cancer. But uh, seeing her condition in the month of August, the way her body was reacting, like I told that, you know, she was sweating profusely even when she was sitting. That's when we had realized that it was something big, and at least me and my sisters, we were somewhere thinking it could be cancer. So yeah, however, my mother was not ready to accept that she got cancer. She kept on believing it's something else. Maybe that's what she used to tell us to give us strength and support. But yeah, so when she was diagnosed, when the PET CT revealed that her entire digestive system was involved, I mean, we were not taken aback completely because somewhere we knew it's something big. Yeah.
So when you were very young when you had to got to deal with so much because your mother, as you said, she was very strong and she used to do everything
Yeah.
alone. And then all of a sudden she is becoming dependent on everyone. Like she is not being able to do much of work.
Yeah.
So it was a lot to take and to watch. So during that period of time, how did you manage to, manage your mental and emotional well-being?
Uh, so, like I said, when the first chemotherapy was given to her on 18th August 2021, within 2 days, she was as if nothing has happened. She started to eat normal food, talk to us. Everything was very much normal. And we were all very confident that we got it right. And just gave her whatever support was needed from our side, but maybe our confidence or overconfidence is what I would call it. Uh, that's what that was another big mistake, maybe. Yeah. So yeah, I mean, we were confident that we have given her the right treatment and she'll be out of it.
Okay, so but I still want to say that you did your best and you did your part. And it's always the journey itself is like that. You always look for the positive outcome. You don't think much negatively. And I'm pretty sure that your mother also would think the same, that you as a daughter did your best. So, and I also hope that during the journey itself, you had your own moments with your mother, a good cherishable moments that you still remember and, have a good memory. So, did any of the lifestyle of hers and yours as a caregiver changed during the cancer journey?
Yeah. I mean, so because during chemotherapy, the doctor had told us that there's a high chance of infection because she'll be in a immunosuppressed state, right? So we had started to, ensure to give her nutritious food like dal every time and green leafy vegetables. And because she was diabetic, so we could not give her normal wheat chapati. We had to give her, diabetic food. So, and we had to ensure that whatever she's intaking is fresh, and the utensils also, before putting the food in the utensils, we used to sanitize as in put the utensils on the gas, ensure that they are sterilized, and then we used to put the food in those utensils and then give to her. So is definitely very important because that gives you a lot of strength to fight the toxins, that are fighting against cancer in your body. So yes, our lifestyle changed a little bit, but her lifestyle definitely changed a lot. By the after I think 2 3 months only, she got pissed off about the food that we were giving her. She wanted to eat some variety, but because you know because of the nutrition that she needed, we were forced to give her dal regularly and leafy vegetables regularly and avoid the sugary foods. So we had to stick to it. However, she used to get angry very frequently, but yeah, uh, we stuck to it as much as possible.
Okay. So, as a caregiver always says that you should never, you should always be open to the to your loved ones because you should not hold any regret after everything has happened. So, what would be your message to the caregivers and patients who will be listening to you?
Okay. First of all, please accept, if you're diagnosed, please accept that, you know, unfortunately, you are one of the victims, be in the form of a patient, be it in the form of a patient or be it in the form of a caregiver. Please accept it. Because once you accept it, only then you will be able to take the right decisions. Uh, and the very second most important thing is, if you want to come out of successfully, you have to ensure you take the right decisions at every point. At every so it would be good if you have someone who can take decisions, keeping the emotional side aside, keeping other aspects aside, right, and take the right decisions. So that's second very important thing. Third, like I said, ensure you reach out to at least 2 to 3 doctors. Understand the prognosis, weigh all your options. What options do you have, right? And very important, keep a you know, thorough checks. Like, for example, could be blood tests, could be CT, could be whatever, depending upon the cancer type, right? So ensure at every stage or after every few weeks or every few months, depending upon like how the doctor suggests, ensure to double check that whatever you are doing is taking you in the right direction. um, yeah, so these two things, like I said, more than one opinion and regular checks, these I understand could be expensive, but uh, I would say that, once you're diagnosed with cancer, definitely you have to be prepared for a decent expense, right? And a life insurance would definitely, sorry, a health insurance would definitely help. So, and you never know, when this strikes. So, yeah. So, these three things, and it would be good if you listen to the patient. By listen, I mean not only what the patient is saying, observe, very important. Like in my mother's case, we thought probably, she's not able to hear, but probably the case was otherwise. Till date, we don't know why did my mother pass away. Till date, we don't know. Some doctors say, uh, it was a side effect of chemotherapy. Some doctors say that the metastasis had happened and the cancer had reached her brain. Till date, we don't know. So yeah, these three, four things, and yeah.
So, as it is very hard for a caregiver to go through so much because the cancer treatment and the cancer journey itself very stressful and painful. To watch your loved one, dealing with battling with cancer and side effects that is making them worse in the situation and in the journey. So, what would be your uh, advice to keep up with the uh, mental well-being of the caregivers?
Yeah. So first, like I said, accept it. And second thing, accept that it has happened to you not because of any of your faults. Okay. You are just a victim. Like my mother towards the end had started to think that she had done some sins, because of that she got cancer, or probably she did not worship her god enough, and that is why she got all that. Please don't think any of those things. Religion and god, maybe I don't know, but yeah, all I'm trying to say is don't blame yourself or your past because of that disease. It's just a disease, and better to take it like that. Otherwise, it will weigh on you, right? If you think you did something, then probably at a stage you'll start to say that, I don't want to take a treatment, or because I did a sin, so uh, it is good that it happened to me. So keep the two things aside, and just take this as a disease. Only then you'll be able to take the right decisions and come out of it.
I completely agree with you that, many caregivers, they say that, they have so many regrets. But yeah, as you said, everything cannot be under our control. Things should go in a flow and we should believe the process. So, so to sum up this journey with your mother, which you will be always be remembering in one sentence, what would it be?
Maybe this was the biggest learning of my life. And yeah, however, just one very good thing that came out of it was this entire, I think, 8, 9 months, I was with my mother. And yeah, so I had actually out of the pretty early, because I did my grads from a other city. So I had stepped out of my city, out of my home pretty early. So my mother used to say that you have not lived with me long enough. Maybe last 8, 9 months, uh, I was with her. So yeah, and she was also really happy about it.
That's good to know. So thank you, Arushi. It was really great knowing the experience, and thank you so much for gathering all the pieces together. I know it would have been very painful for you to go back and recollect what all happened and then share it here. It takes a lot of effort. So thank you so much for sharing your experience as a caregiver on our platform. And it was really, really good to know that you are slowly recovering from this, and your mother is was a very brave warrior. Actually, it's not about winning or defeating; it's about battling against cancer. So, keeping that in mind, always stay strong and all the best for your future endeavors. Take care.
Thank you so much. I just hope someone benefits from this. Yeah,
Of course, they would. So,
thanks.
thank you.
Thank you
Take
for
care.
hosting.
Bye.
Yeah, thank you. Bye.